So, my presentation or my research is on osteoporosis in premenopausal women in cardiovascular rehab in Georgia. So, if my research was implemented today, it will follow women in this rehab facility in Georgia over the course of a 3 months to a 9 months period. Just following these women, seeing implementing my program using different type of intervention and techniques and see how they progress after the research was done. So an overview of osteoporosis. Osteoporosis has become a major public health problem, not only here in the US, but globally. It does have a serious potential impact on health and healthcare expenditure, meaning that, women, premenopausal women, sometimes, they're in their 40s, 30s sometimes, and in their 50s. So these are still women out in the workforce. And if they suffer a fall that result in a fracture or a break, we're looking at a hospital stay, and most likely when they get discharged from the hospital, they end up in a rehab facility. Now, how does that look for their lifestyle? They have to lose time from work, away from their family, and it's such an impact on their health, meaning that they can get secondary disease process, that will have an impact on their recovery process. So, osteoporosis affects approximately 75 million people, not only in the US, but in Europe and Japan. And approximately 10 million Americans were diagnosed with osteoporosis, and more than 30 million are at risk due to low bone density. This is why it's so important that early intervention, being proactive with our patient, educating them about the disease process so that they can take the necessary steps to prevent or decrease um, getting osteoporosis or getting injured from osteoporosis, which will result in alteration in their health and healthcare expenditure. So osteoporosis is a disease that consists of low bone mass and structural deterioration of the bones and tissue. So we always, as healthcare worker, we always, you know, look at our patients and we said, okay, so the patient will say, when I was in my 20s, I was six something, or I was 5'5", and now I'm 5'3". We say, oh, you're shrinking, you lose bone density when you get older, meaning that the patient is losing bone mineral from their bones, so they're shrinking, but actually telling the patient that this is due to osteoporosis, losing minerals in the bone, this is why you're shrinking. So the more we educate women and men about the process of osteoporosis, it will be better, because millions of people are going undetected and misdiagnosed for many years, because this disease sometimes mimic other disease process, whether it be autoimmune deficiency disease that with fragile bones, or just shrinking, losing bone mass. We need to let our patient know that this is a serious health crisis, and which can be prevented or decreased if we do early intervention and be proactive about their health. Early indication. So current research is ongoing to test the performance level of those with bone disorder in the area of strength, balance, and flexibility. How do they do that? Through aerobics exercise, strength, weight bearing exercise, and strength training. Flexibility such as stretching, yoga. Research have shown that these type of exercise, when implemented in as little as 15 to 20 minutes a day, will increase bone strength, will increase balance and flexibility, in women with um, premenopause or those with postmenopausal symptoms. Cause and prevention. One of the most important findings of research about osteoporosis is that there are not one single cause for the disorder. As I mentioned before, there are many entities that, when combined, can cause the illness. So, fragile bone, autoimmune disease attacking the body, attacking the bones, can cause women to have um, low bone density and sometimes be misdiagnosed um, of the osteoporosis. Okay, so premenopausal osteoporosis is sometimes will have a secondary cause, meaning bone disease, fragile bone, autoimmune bone disease. Sometimes it will be classified as idiopathic osteoporosis. Implementation and outcome of osteoporosis. Again, because we said there's not one thing that causes the disease, there are many different type of lifestyle adjustment that can be done to be favorable in the disease outcome. So when we know that a patient is deemed to have low bone mass density, and does have a history of fractures associated with osteoporosis, a combination therapy would be best, such as psychotherapy and drug therapy can be used in treatment to be very effective for these patients. The World Health Organization has determined that low level of physical activity constitute to four leading risk factor for death worldwide. So get up and move. Active is what we want to tell our patient. Move in, walk in, uh, weight bearing. This is what we want you to do, because the more you move, you strengthen your bone. Not just moving, but the type of exercise that we want you to do to help your bone, um, strengthen your bone, decrease the onset of osteoporosis, and improve health. Intervention and policies that focus on diet, physical exercise, and sedentary lifestyle will help to decrease fracture in women. Research has proven that when these are implemented, it decreases the risk of osteoporosis. So in 2013, the North American Menopause Society got global census on the use of menopause hormonal therapy, MHT. Recommend that Recommendation of MHT should be based on geographic variation, individual need, and priority of medical care. So when we talk about implementing MHT, we have to look at where the patient is, the individual need, and priority of medical care. And those are the criteria or factors that, as practitioners, we need to take into consideration when we're looking at these women. It MHT is more beneficial before the age of 60 or within 10 years of starting menopause. This is what research has found, that there's a window. If you start it, the impact or the result will be greater between the window of before 60 and 10 years of starting menopause. Impact of healthcare policy. Women less than 60 of age starting MHT can reduce morbidity and mortality from health disease. It prevents the escalation of bone turnover and escalation from menopause. So when patients start MHT, the acceleration of bone turnover will decrease, and the acceleration from menopause will also decrease, which will be favorable for women. Slow down the turnover, decrease menopause, help to decrease the incidence of osteoporosis related to fracture, and that is what we want as practitioners. Analysis of policy, quality of care delivered to women with osteoporosis has been improving by using MHT. So there is a proven research that if we use MHT, osteoporosis in women will decrease and we'll see improvement in bone health and decrease in fractures. Exercise and diet rich in calcium and vitamin D is what we want to emphasize with our patient. Avoidance of smoking and alcohol and maintaining a recommended body mass index 24 or lower. 24 no, is the magic number where we want. And of course, your BMI will be based on your height and your weight. So, um, 24 for a smaller individual. And then based on your height, we looked at that as we talk about BMI and what is within normal range for that individual. Researcher policy believe that protection from the use of MHT will decrease after cessation of use. So once you stop using it, there'll be a decrease in the bone turnover. It will start turnover as rapidly as it did before, and it will predispose the individual back again to fracture and bone loss. Here's a list of my references. You can get information by just clicking on these references or putting them in your browser and get more information on osteoporosis in premenopause of women. I thank you for